Hello students of class 11, welcome to the online tutorial classes for Vidya Bhavan High Secondary School. This video is for class 11 nutrition and the chapter I am going to continue is the carbohydrate. This video is part 11 from this chapter. So in this video we will discuss about the different types of the diabetes mellitus. In the previous video, we discussed about the differences between diabetes mellitus and diabetes insipidus. But in this video, we are going to discuss about the types of diabetes mellitus. So it is usually the type 1, type 2 and gestational. Okay, there are three kind of diabetes mellitus. Let's check.
Now we are going to discuss about the diabetes mellitus, and diabetes mellitus is a group of diseases characterized by high blood glucose concentration resulting from defects in insulin secretion. Insulin action and secretion, actually both. Insulin is a hormone produced by the beta cells of the pancreas, and it is necessary for the use or storage of the body fuels, that is the carbohydrate, protein and fat obviously. The person with diabetes generally may produce less insulin or maybe several other causes as well, and sometimes the insulin resistant also. So here you can see that the types of diabetes, that type 1, type 2 and gestational diabetes, the body do not generated sufficient insulin or for glucose regulation in the type 1 diabetes, and the IDDM accounts for 5% to 10% of diagnosed causes of diabetes. IDDM full form is insulin dependent diabetes mellitus. That means the person needed the insulin by the injection or somewhere. These patients have deficient insulin secretion actually. Although it may occur at any age, most of the cases are diagnosed in people younger than 30 years of the age, with a peak incidence of 10 to 12 years in the girls and 10 to 14 years of the boys. So the main symptoms are they are excessive thirsty every time. The frequent urination is very common. The polyuria, that is the excessive urination. Next, the polydipsia, that is excessive thirst, dehydration, electrolyte disturbance, and ketoacidosis. These are the common symptoms of the type 1 diabetes. Now in the second case, you can see that the type 2 diabetes means insufficient insulin secretion for blood glucose regulation. It is also called the NIDDM, that non-insulin dependent diabetes mellitus. It accounts for 90 to 95% all diagnosed cases. It is the most common type of the diabetes mellitus, and it is a progressive disease, and it generally occurs in people who have a genetic tendency, especially the intra-abdominal obesity, and physical inactive, and have a prior history of the gestational diabetes may also lead to the type 2 diabetes. This is the condition, and maybe a combination of the insulin resistant and the beta cell failures. Sometimes insulin secretion may be normal, depressed or elevated. The symptoms are more or less same, like hungry, unexpected weight loss, numb and tingling of the hand and feet, frequent urination, sexual disorders, extreme fatigue, always thirsty. These are the common things. And the other complications that you can see, that wounds healing slowly, peripheral neuropath, the cerebrovascular diseases, the diabetic neuropathy, coronary heart disease, eye damage, etc. These are the very common things. The next is gestational diabetes. It is occurring in 7% of the all pregnancies, and it is in the condition characterized by high blood sugar level during pregnancy or the gestation period. Usually after delivery, most of the women become normal, but some cases it can continue also. That is, the glucose level reduces in the normal level, but sometimes they became diabetic. So there are some differences between the diabetes 1, that means type 1 diabetes, and type 2 diabetes. Let's check. So here it is the differences between type 1 diabetes and type 2 diabetes. So in the first point you can see that often diagnosed in childhood usually. Type 2 is usually diagnosed over the 30 years of the age. Type 1 diabetes mellitus is not associated with excess body weight. Type 2 is associated with excess body weight. Type 1 often associated with hunger and normal ketone levels at diagnosis. Type 2 often associated with a high blood pressure or the cholesterol level high. Type 1 diabetes treated with the insulin injections because it is insulin dependent, but type 2 diabetes is initially without medicines or with tablets. Uh, you can just take care of it. The insulin dependence is not needed. The next is it cannot be controlled. The type 1 diabetes mellitus cannot be controlled without taking insulin, but type 2 diabetes mellitus usually can be managed with the use of drugs and lifestyle modifications.
So after the discussion of the differences between type 1 and type 2 diabetes mellitus and some of about the gestational diabetes, we are going to discuss about some more excess result, that is obesity. The obesity is a very common problem that is occurred due to the excess of the carbohydrate consumption. So if we consume extra amount of the carbohydrate, it obviously provide you the extra energy, extra calorie, and for the long time consumption it can cause the obesity. That is a killer, the silent killer you can say. Okay, so you should avoid the free carbohydrate consumption in your diet. Now going for the deficiency. So the deficiency are mainly first the ketosis. Deficiency means that when we are consuming less amount of the carbohydrate. So the first is ketosis. So the deficiency result first is ketosis. Ketosis is mainly forming in the absence of the carbohydrate. Fats are broken down and provides the energy. So the excess oxidation of the fats as well as protein and produces the acetyl-CoA molecules. Accumulation of the acetyl-CoA molecules can lead to the formation of the ketone bodies in our body. So the ketone bodies are mainly of acetoacetate, beta-hydroxybutyrate and acetone. These are the three kind of the ketone bodies that can be accumulated in our body. The increase in the concentration of the ketone body is known as ketosis. So it is an alarming disease. The ketosis is an alarming disease because it can lead to the coma too. The ketosis may be manifested in the ketonemia, like the ketone body in the blood, and ketonuria, that is ketone body in the urine. So ketone bodies, when it reach to the brain, it can form coma or encephalopathy, that is very dangerous effect. And other conditions, deficiency of the carbohydrate can cause liver damage as liver loves the carbohydrate most. And low carbohydrate is associated with problems in the nervous system and brain because the brain main food is carbohydrate too, and leading to the fatigue, depression, confusion and dementia, etc. because carbohydrate gives us the positive energy. So these are all about the excess and deficiency and the differences between type 1 and type 2 diabetes mellitus. In the next video we will discuss about some short notes. Till then, thank you.